Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. And as always, if you like what you see and hear, subscribe. Leave us a comment. Tell us what you think. So, this is a show where we speak to nurses anywhere on the globe and at any stage in their nursing career. And we talk about our inspirations, our challenges, our vision for this profession of ours. And today, I am very, very pleased to welcome Ms. Glory Iwuchuku. Glory is currently in the United Arab Emirates. She is a registered nurse. She is a registered midwife. So we're going to talk to Glory today. Welcome, Glory, and thank you so much for doing this.
Thank you. Welcome to.
So let us start by, I always want to know, my first question to nurses is always, why are you a nurse? What brought you into nursing?
Actually, what brought me into nursing was through my auntie, who is my mentor. I love the way she was treating people. You know, back home, we do private practice, even after retirement. You know, I saw the honor the community was giving to her. She was seen as a second god, you know.
Yeah.
You know that kind of feeling when people honor you because you are giving them all you have.
Yeah.
So that really pushed me. I told myself, this nursing will actually also suit me because I have the same personality like her. So that was what led me to nursing.
Okay.
Actually, I wanted to be a medical doctor, but just because she was treated like a second god in the community, I decided to go for it.
Okay, and you think this was the best decision for you now?
Yes.
Yeah, I agree. So you became a nurse in Nigeria, is that correct?
Yes, sir, yes.
Okay, so did you ever work in Nigeria or did you always work in the UAE?
Yes, I worked in Nigeria. I worked in the community because I prefer community nursing or community midwifery. Because those people in the rural area, in the community, there's bridge between them and the city. The city, they have more facility than those in the community back home. So I prefer working in the community mostly. But when I was not, because I was working with this WHO and UNICEF, it was a contract base. So I decided to ask for a transfer, but it wasn't granted because they needed people in the community more. But I felt I needed to start my own family. Because of the distance between me and my husband, I decided to move to the city. Otherwise, I wouldn't have moved to the city because it is a very good, working in the community is a very different experience when you know what you are doing.
Exactly. I know what you're saying because you don't have the same, you're a lot more autonomous. You have to be a lot more innovative and resilient and resourceful. Because you're it.
And you know, when you are always present, when anybody from the community wants you, you are valuable. That is the most important thing. Even if you don't have an answer to their problem, but once you refer, they will know that you know what you are doing. This is a case you cannot handle. Therefore, you have to make immediate decision to transfer the case out. The community also welcomes that so much.
Yeah.
They welcome that so much in the community.
That's really that's a big thing. And it strengthens you. It gives you the confidence you need to step out anywhere. It's huge. Yes. So you're a nurse, you're a midwife, right? And move from Nigeria to the United Arab Emirates. Any challenges there?
Now, UAE is a very friendly country. No challenges so far, but it's just for you to obey their laws, because every country has their laws. They have their own culture. So you have to adapt to fit in. Once you fit in, you know their culture, their laws, their rules and regulations, you are good to go as a foreigner.
Okay. All right. And so now you're working in the Emirates as a midwife.
Yes.
Correct? So are you working in an institution or again back in a community-based setting?
In an institution.
Hospital setting,
Yes, hospital setting.
Yeah. So is that your preference, or is that because that's what they need? To work as a midwife rather than as a nurse?
I'll prefer community. If I see community here, I'll prefer community.
Anytime, anytime.
Anytime. If I am leaving UAE to another country, I also prefer community setting.
Yeah.
Because there's a different feeling working in the community. If you know what you are doing, you are behaving like them, you are behaving like one of them. They don't know the people will find it difficult that you're a foreigner. The community loves that so much. You eat whatever that is available, you dress like them, you behave like them. Even if you're a Christian, like back home, I was a Christian, but sometimes I pray with them during their praying time, because they pray 5 times in a day. And I will not say because I'm a Christian, I will not obey their religion.
Got it.
So they love that. You see why I love community.
Yes. I'm beginning to see that. They love it and so do you.
Yes, and once they get their type of food for you, you don't reject it, even if you don't want to eat. Like for me, they were bringing food for me. It took me some time to adapt to the kind of food they eat. So I always receive and give it to the security man on duty. But at a time, I started getting used to their food. Like here, I eat more of Arabic food here.
Okay. So how long have you been in UAE?
I've been here since 2019, but I've been practicing since 2020.
Okay. Awesome. So in the United Arab Emirates, are there any aspects of nursing life or as a midwife that you think you would like to see change?
They don't have community midwifery here. Home visits, I think is beginning to be in place now for some institutions. Because home visit also is part of community midwifery. Here, I have not witnessed it.
You have not, yeah. All right. So people go home pretty much on their own once they leave.
Yes, maybe because I'm seeing it because of maybe healthcare services is available for everybody, easy for everybody to access. Maybe that is why I'm not seeing more of community nursing or midwifery here. Because where I stay in Abu Dhabi, community healthcare services is very fast to access, easily accessible. Even if you don't have insurance, seeing your case, they will attend to you immediately. That is the most fabulous thing here. Whether you have insurance or not, provided you are in a critical state or you want health service immediately, immediate attention is being given. That is a wonderful thing here in UAE.
Okay. Okay. That's awesome. That's really a great thing, because as we all know, if you don't have health, you don't have anything. So that you're able
Yes,
to
health is
access
wealth.
services is awesome. Yeah. Yeah. So Glory, what would you say is your greatest achievement so far as a nurse or as a midwife?
The greatest thing I've achieved is, in fact, I cannot mention, especially here in UAE.
Okay.
I've been exposed to international practice.
Yeah. Yeah.
That is the most achievement I have achieved in my life. Getting to meet different people from different continents of the world. That
Okay.
is one of my greatest achievements.
Okay.
At least it has exposed me to knowing other people's culture.
Yeah. And that's really a big thing. If you're going to take it, because as nurses and midwives, we take care of people in a very intimate way.
Yeah.
And so it's really important that you have some kind of knowledge of who they are and what they expect and what their culture leads them to expect and to hope for from you. So that's awesome. That's really good.
Yes, and also getting to know, back home, we don't really like here. Internationally, you are meant to tell a patient what a patient is receiving. But back home is not that way, because the healthcare practitioners think that when that person is sick again, the person will know the kind of drugs that was given to him or her.
Yeah.
So the person can easily go to the pharmacy. Back home, we call it mostly chemists.
Yeah.
They can easily access the chemists, thereby reducing their own profits.
Ah.
So a patient can ask you, what drug are you giving me? Here you will easily tell the person, even before you can administer those drugs, consent is being taken.
Yeah.
But back home, it's very difficult to tell somebody, this is the drug I'm giving you, which is not a good practice back home.
Yeah.
Whatever that is being given to patients is accepted. But here is not that way.
Yeah. It's much more transparent. It's a little more.
Yes.
Patients are more involved in their own care.
Yes, autonomy. Yes. Everybody takes their decision, consents, everybody is treated fairly, irrespective of your financial status here.
Yeah.
Everybody is treated equally.
Okay. Awesome. Very good. So here in the United States, we are encountering or noticing that there is a lot of burnout in the nursing profession, and a lot of people are leaving. Are you having the same issues there?
Yes, we are having same issues everywhere. Nurses migrating. Maybe I'm migrating to maybe Canada. I find it very, very comfortable. Of course, you wouldn't expect me, if I'm somebody that is open. I have friends back in UAE. I'll tell them, come on, girls. Canada is better, and you'll see people, healthcare workers, leaving their former place of work to get a better life, thereby causing shortage of nurses in a particular region.
Yeah.
And the that are doing the work, they don't have any other choice but to pass through stress.
That stress thing.
And I think the highest burnout rate was during the COVID time. Most region has experienced.
Yeah. That pandemic really did shine kind of a bright light on just how stressful you know, delivering healthcare can be, and not just for nurses, but I would say especially for nurses, but also with all sectors of healthcare.
All sectors. You know,
Mhm.
imagine you coming to work and you are supposed to be like 6 on duty, and they are telling you 3 out of the 6 people are COVID positive.
Yeah.
At that time, because here we're expected to do our COVID test every 2 weeks.
Yeah.
So if it falls in within the 6 people at the same day to do their COVID test and they turn out positive,
Yeah.
and you calling somebody, maybe you are supposed to resume, the shift starts by 6, and people, their results comes in by around 4 or 5. You don't expect people who have not rested, who have not slept, to come to do the shift.
Yeah. Yeah.
And those that are already in don't have any choice but than to experience burnout.
Yeah. 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 So as we're talking about burnout, though, one of the things that I say is that we, as nurses, very often neglect ourselves, which is one of the things that, in my view, contributes to this burnout. So, what does self-care mean to you?
Self-care means taking care of yourself personally. Emotionally, you need to take care of yourself emotionally, socially, physically.
Yeah, yeah, yeah. And often we don't. Often, you know, we just keep going.
Yes, we keep going, we don't care.
Yeah, yeah. And we keep put ourselves further and further and further back on the list of things that we need to pay attention to.
Yes.
And you know, as caregivers, really that's not what we should do.
Yes, we don't. But other people in other field, they take care of themselves. Nurses, especially, they are thinking of how will my next shift be? Hope I'm not going to have a difficult patient. Hope I'm not going to be so busy in my next shift. Things like that. Because your colleagues expect you to be active, which is not supposed to also be. Forgetting that your fellow colleague that is a nurse is also a human being, can be passing through emotional stress. You don't know what the person experienced at home before coming to work.
Exactly, exactly. And you know, that is something that I really think we need to pay attention to. We treat
Yes.
ourselves that way. Our colleagues treat us that way. We treat our colleagues that way. You know, it's
Yes.
almost as if we're automating ourselves at times. That cannot be good, and it contributes to all of this burnout that we're seeing, all of this dissatisfaction, all of this throwing up the
Yes.
hands and like, you know, I can't do this anymore kind of thing. And a lot of it is because we have forgotten that we are people. We need to fill up ourselves. We are people too. We need to be, you know, emotionally, physically, you know, mentally, spiritually, rejuvenate ourselves and pay attention to
Yes.
things that rejuvenate us. So yeah.
If only nurses can learn to love themselves, I think healthcare will be more enjoyable. You know, also welcoming the younger ones into the profession, because we too, we did not learn it one day. It took us time, it took us years to have this experience.
Yes.
And not also only the burnout is a problem, bullying in the healthcare is also a problem worldwide.
Yeah.
Your colleague do a mistake, instead of you to correct that person, you are gossiping. You are going to meet Nurse B to say, did you see what Nurse Glory did? She was wrong. Why you have not corrected Nurse Glory at that spot? So how do you expect Nurse Glory to know that what she did was wrong? Because we don't know it all.
Exactly. Exactly. Especially in a profession that is constantly evolving. You know?
Because you may think you know it all, but you don't know it all. Because I prefer telling my colleague, come on, Nurse B, you are wrong. Don't do that next time, to withhold the bullying in the workplace.
Yeah.
Some people will go down immediately and say, oh my God, I'm going to work with this nurse again. That will increase chances of making more mistakes, because when you are trying to be more careful, the mistakes will keep occurring. You get what I'm saying?
I hear what you're saying, for sure.
When you are being careful, more mistakes are occurring. And especially with those ones that cannot correct you, but they keep going around to gossip. Because of that fear in you, you keep making mistakes.
Yeah.
You see your fellow nurse is having panicking syndrome,
yeah,
anxiety when they
yeah,
see their fellow colleagues.
yeah, I know. Yeah, it doesn't contribute to your confidence at all.
Yes.
Yeah. So, Glory, I am trying to see what nurses see in each other. And so I ask this question. If you had to describe the most essential quality of a nurse in just one word, what would that word be?
Kindness.
Kindness. All right. Kindness. You gotta be kind. You really do.
Yes, you have to be kind to be a nurse. If you are not kind, I don't think you can be a nurse.
Not a
Nurses are meant
successful
to
one
be
anyway.
kind. Huh?
I said not a successful one anyway. And
Yes,
successful, successful in the sense that you're the person you're taking care of or interacting with feels that they have been taken care of, or feels that you have,
yes.
successfully interacted with them. So yeah.
Because in that kindness, you see comfort, you see a nurse being sympathetic, empathic, patient, and all the qualities. That is why
All
I'm
of those
using
things come under
kindness.
the kindness umbrella.
Yes.
Yeah. I hear that. I see that. I see that. Um, as nurses, yeah, we have to be kind. Even when you have to be firm, and sometimes you do have to be firm with patients, because for all kinds of reasons, people sometimes are not willing to participate in their care, or not willing to participate in the way that is best for them, or will help them, or as part of your education, they have a different idea. And in educating someone about their particular thing, sometimes you have to be a little firm, but you can be kind.
Yes.
Yeah, absolutely, I agree. Absolutely, I agree. So,
And in that also you find being patient,
yeah, yeah.
because as a nurse, you can receive 100 questions within 1 minute.
Yes, yes. That is
You
very
have told a patient, this is paracetamol. It will relieve your pain. It will take some time. You are leaving the room, the patient is buzzing the bell again to ask you more questions on that paracetamol. So you have to be kind.
Yeah, indeed, indeed. That is absolutely true.
Just like in midwifery, we know labor is painful, but our duty as midwives is to encourage the woman, support the woman to reduce the pain. And sometimes you find very difficult patients. They are laboring, they don't want to take any analgesic of any form.
Yeah.
You don't have any choice but to be calm with them. Each
Yes.
contraction, you are being called, I'm having pain. Madam, please, why not take analgesic or anything or epidural? They will tell you no. My mother said I will get paralyzed if I receive epidural, you know. Just so one needs to be kind. One needs to
Indeed.
be kind.
Indeed. Indeed.
One needs to be kind.
Yeah, that was
One needs to be
one
kind.
needs to be kind to your patient, to yourself, to your colleagues. Yeah. It needs to be one of your watchwords. Kindness. So Glory, I really want to thank you for this conversation and for taking the time to talk to me today. It's been enlightening and I really, really appreciate it. Okay.
Is that okay?